Hello, my name is Suzanne Gilbert, and I'm delighted to be with you today for one of my favorite meetings in the world, the All India Ophthalmological Society Conference. I am pleased to be invited to address a topic close to my heart, the building of the eye care team research skills for quality and sustainability. Some of you may recall that there was a session in February 2019 on collaborative research internationally. And this talk has a relationship to that one, which I hope some of you will recognize. First, I'll address for several minutes the movement for research capacity building, also some case examples, and then I'll address the benefits of promoting research capacity building in your institution. Types of research to be addressed involve population-based epidemiological research, operations research to improve service delivery, literally quality, volume, equity, sustainability. And also many of us have routinely had access to training in clinical research to improve clinical outcomes, all of these being very important. A leading study out of UK several years ago addresses why research by our health workforce. Why do we even consider people who are implementing healthcare to conduct research into healthcare? And the findings are very, the orientation and findings were very clear. On the one hand, that everyone benefits from a research engaged workforce, that the researchers tend to keep up to date, research is focused on practical matters, and participation in quality improvement adds dynamism to one's career and opens up one's horizons. The findings are that in the UK, of the 2,000 people responding, all of them doctors, although some of these findings can apply to many other personnel. There's a strong interest in research, but a concern that they didn't have the time or funds to move into the research. Women in particular found it difficult to fit research into their busy clinical and family life. Those consultants more advanced in their tenure found that they had not been doing research early enough to really hone those skills well, whereas they were very interested, and younger trainees found that learning and excelling at research gave them a competitive edge, and also they benefited greatly from research training coming earlier in their career, which is being done more and more these days. There is a growing literature into effective practices for teaching research. This is just one example of a multidisciplinary method for teaching implementation research, in this case in the public health setting, but it has lots of corollaries to our settings as well. Research is done collectively, and regional research strengthening is a huge part of the current movement. This is an example from Africa. We can find examples from several regions and countries, and an emerging literature is coming out. Finally, evaluation into what methods work for building research capacity are critical, and that evaluation is being conducted at the individual researcher level, at the level of their team, which is a big focus that we have in eye health, focus on research teams. Also, the evaluation of RCB on the organization itself and the larger networks the organization is part of. SEVA and our partners have a long legacy of research activity together, which over the decades has moved into research capacity building, so partners themselves can perform more of the research that's very important to them. Critical is that the partner be in the driver's seat when it comes to establishing the research priority and the team that will get it done. The research is designed in a way that it's highly relevant to service delivery, linked with that service delivery, and yet distinct, so we protect the time and resources required for the rigors of the research. Training, of course, is part of this process, and it results in the ability of partners to cross-share their results with each other and with the world. SEVA has worked with partners in many different ways to help develop research competence and capacity. A recent and ongoing activity is described here. It's building operational research capacity for eye service improvement, a joint initiative of the Indian Institute of Public Health Hyderabad with SEVA. This was our first face-to-face meeting in December of 2019. It was to have been the beginning of a series of face-to-face meetings with teams over time to promote the project. In fact, what was originally seen as being a 12-month project with intermittent face-to-face and virtual sessions has become a 20-month-long workshop, entirely virtual, learning by doing. It involves 4 eye hospital teams, 3 from Nepal, 1 from India. The teams are interdisciplinary and from different levels of the institution's hierarchy to ensure that the research is understood by all, including the people actually doing its implementation. Ultimately, everyone needs to learn from the research. Multiple strategies are being employed by the very skilled faculty of the India Institute of Public Health Hyderabad, working with SEVA partners and SEVA consultants and staff in conducting large group learning sessions and a series of iterative small group, customized, tailored learning and reinforcement opportunities. Important is that the groups cross-share their progress, their challenges, their snags, and their successes as they go through this process. Here's a glimpse at an all too familiar Zoom meeting. You all have hundreds of these emblazoned in your mind. Here, Professor G.V. Murthy is speaking to the particular group for this cross-sectional activity. The research capacity building workshop underway addresses all of these aspects of the research arc. Particularly large effort was put on the selection of the question, because in doing that, each team had to really take on what they would be required to do to research a question of their design. And then they learned about the other key steps in the research process. Very importantly, because of COVID, this timeline has been extended. So right now, teams are getting a hand on into article writing by writing up their research protocols for publication. So even though we've had some snags in timings, we're using the time well to reinforce critical skill development, which is useful for this workshop and for the rest of one's career. I personally find many benefits to including research capacity building in your institution. I have found, and research has indicated, that by engaging in the research process, there is a greater staff awareness for need for practical evidence. It popularizes routine data collection and review, because people have a fresh appreciation of the importance of data and how it can inform and improve their work. Also, having the research component embedded in your institution and its DNA opens you up to research collaborations globally and locally. These are very stimulating and can make the research much more effective. Of course, most people, when they think of research, they think of publications. When we think of research, yes, we think of the publications, but moreover, how those data and findings will be used to improve service quality and sustainability within your own institution and as part of continuous improvement. So I look forward next year to be able to address with a series of colleagues the next chapter, strategies for building research capacity. I'm delighted to participate in the discussion following these several talks today, and I thank you very much for your attention. Thank you.